हेलो एवरीवन एंड अगेन वेलकम बैक टू आवर चैनल। तो आज आम वीडियो नर्सिंग एप्टीट्यूड जैसे पार्ट 2 ये वीडियो जब आपने पार्ट 1 यार देखना तो निश्चित देखना डिस्क्रिप्शन में मुझे लिंक दे दूँगी एवं आपंकर जहाँकि डाउट था जे आर वर्ष प्रिवियस ईयर एमती सब क्वेश्चन पड़ी नाला नर्सिंग एप्टीट्यूड तो आप जानी रखुद पूर्व वर्ष जो होता है बीएस नर्सिंग एंट्रांस एग्जाम तो फास्ट टाइम कंडक्ट होता तो आम जो सिलेबस है नर्सिंग एप्टीट्यूड से गवर्नमेंट नर्सिंग एप्टीट्यूड सिलेबस सहित कौन भी पकई नाला जहाँ जो पकई क्वेश्चन नर्सिंग एप्टीट्यूड बदल में जेनेल एप्टीट्यूड जहाँकि जेनेल एप्टीट्यूड सिलेबस पकई तो से गवर्नमेंट को कंप्लेन जाता और कंप्लेन बदल से किसी आमको किसी माने किसी आमको रिप्लाई दे नथिले किंतु जहाँ जना पड़े आमको ग्रेस मार्क पिला मिलता पिला कौन ना किसी ग्रेस मार्क मिलता तो से भाव में तो एथर लगुच सेमती करना कारण एथर नर्सिंग एप्टीट्यूड सिलेबस ही पकेब तो आपने माने यही क्वेश्चन आपको आसवा जाऊँगी तो किंतु पूर्व वर्ष कौन होता किंतु जेनेराल एप्टीट्यूड क्वेश्चन पकई तो जेनेराल एप्टीट्यूड जब क्वेश्चन जाना आप निश्चित भाव जेनेराल एप्टीट्यूड क्वेश्चन देखिपारे ऑनलाइन इंटरनेट रे किंतु ये हूँ आप जहाँ भी अच्छी नर्सिंग एप्टीट्यूड सिलेबस तो आप आशा अच्छी कि ये वर्ष नर्सिंग एप्टीट्यूड सिलेबस पकेब सेमती पूर्व वर्ष भाई किसी करनी बोली आम आशा अच्छी तो ये आपड़ी भाव ही पढ़ी जाता तो जदि भी क्या मन किसी भी डाउट थाए तो निश्चित भाव ऑफिशियल वेबसाइट रे जो जीमेल आईडी आपको मेसेज करें तो चलो हम वीडियो को स्टार्ट करवा जैकि नर्सिंग एप्टीट्यूड तो यह पूर्व आपने कौन आज आम चैनल को सब्सक्राइब करना सब्सक्राइब कर दिखाँ कारण ये समस्त कंटेंट आम चैनल अपलोड कराए मुझे आउ थे कर रखी चाहिए जदि आपने पूर्व वर्ष प्रिवियस ईयर वीडियो नर्सिंग एप्टीट्यूड देखी ना तो ये निश्चिंत देखी ना कारण बहुत सारा इंपोर्टेंट आप हेल्पफुल रहा तो तार लिंक टोटल प्ले लिस्ट लिंक ही मुझे दे दिए आम डिस्क्रिप्शन वीडियो डिस्क्रिप्शन में तो निश्चित तले जाए देखी नि तो चलते वीडियो को स्टार्ट करवा तो देखो फास्ट क्वेश्चन कौन रही The normal breath rate of human being is option A 12 to 15 per minute, option B 22 to 25 per minute, option C 15 to 18 per minute ना option D 20 to 24 per minute तो यार करेक्ट आंसर है आपनकर कौन ना 15 to 18 per minute तो option C is the correct answer है the normal breath rate of human beings is 15 to 18 per minute. Next question. Volume remaining in the lungs and airways following a maximum expiratory effort is known as option A residual volume, option B total lung capacity, option C vital capacity ना option D tidal capacity तो यार करेक्ट आंसर है कौन ना option A residual volume. Volume remaining in the lungs and airways following a maximum expiratory effort is known as residual volume. तो आम पूर्व देखो तो यही वर्ष ही प्रिपेरेसन वीडियो मुझे ब्रीदिंग एंड एक्सचेंज ऑफ गैस गोटे वीडियो अपलोड करी बायोलॉजी इंपोर्टेंट क्वेश्चन डिस्कसन करी तो ये जो विषय समस्त रेसिडुअल वॉल्यूम वाइटल कैपेसिटी टाइडल कैपेसिटी ये विषय टोटाल भाव ये वीडियो आलोचना कराई तो निश्चित भाव से वीडियो जब आप चाहिए निश्चित भाव देखिपारे. नेक्स्ट क्वेश्चन. The most reliable way to assess the respiratory rate of the patient is option A observe the chest rising and falling, option B listen and feel the air movement, option C count the respiration 10 seconds and multiply with 6 and D option use cardiac monitor. तो यार करेक्ट आंसर है आपनकर कौन ना ऑप्शन ए ऑब्जर्व द चेस्ट राइजिंग एंड फॉलिंग. द मोस्ट रिलायबल वे टू असेस द रेस्पिरेटरी रेट ऑफ ए पेशेंट इज ऑब्जर्व द चेस्ट राइजिंग एंड फॉलिंग. नेक्स्ट क्वेश्चन. An abnormally slow breathing rate is called. An abnormally slow breathing rate is called option A bradypnea, option B bradycardia, option C trachypnea, now option D trachycardia. तो आप स्लो ब्रीदिंग रेट तो स्लो ब्रीदिंग रेट आप कौन हो ना ब्राडीपनिया ना आप स्लो ब्रीदिंग रेट कौन हो ना ब्राडीपनिया ऑप्शन ए हो करेक्ट आंसर. तो ये आप देखी नि ब्राडीकार्डिया कौन ब्राडीकार्डिया हो स्लो हार्ट रेट और ट्राचिकार्डिया हूँ कौन माने रैपिड हार्ट रेट बा फास्ट हार्ट रेट को ट्राचिकार्डिया कहुए कि स्लो हार्ट रेट को ब्राडीकार्डिया कहुए से आप स्लो ब्रीदिंग रेट को आप ब्राडीपनिया कहुए से फास्ट ब्रीदिंग रेट को आप ट्राचिपनिया कहुए तो ये हार्ट रेट आउ ब्रीदिंग रेट भितर जमा भी कन्फ्यूजन हे ना तो भल भाव भाई आंसर टी देवे. Kurzweil breathing. Kurzweil breathing is a deep and labored breathing pattern often associated with option A diabetic ketoacidosis, option B hepatitis, option C hepatomegaly, and option D acute renal failure. Now Kuzumal breathing is a deep and labored breathing pattern often associated with correct answer ହେଇଯିବ ଆପଣଙ୍କର କ'ଣ ନା correct answer ହେଇଯିବ ଆପଣଙ୍କର option A diabetic ketoacidosis. Next question. Irregular respiration characterized by apnea and hyperventilation is known as. Irregular respiration characterized by apnea and hyperventilation is known as. Option A Chinese Stokes respiration, option B hyperventilation, option C Kurzweil's respiration, now option D sighing. The option कौन है जो करेक्ट आंसर ऑप्शन ए चाइनीज स्टोक रेस्पिरेशन. The irregular respiration characterized by apnea and hyperventilation is known as Chinese stroke respiration. Rate of ventilation exceeding normal range is known as. Option A Chinese stroke respiration, option B hyperventilation, option C Kurzweil's respiration, now option D sighing. तो correct answer is आपन hyperventilation. Rate of ventilation exceeding normal range is known as hyperventilation. तो important question मन रखिथिबे. Next question. Respiration is abnormally deep but regular is. Respiration is abnormally deep but regular is. Option A Chinese stroke respiration, option B hyperventilation, option C Kurzweil respiration, और option D sighing. तो option C है जो करेक्ट आंसर है Kurzweil respiration. Respiration is abnormally deep but regular is Kurzweil's respiration. Next question. Hypoxia is. Hypoxia कौन है जो ऑप्शन ए अच्छी lack of oxygen in the tissue, ना lack of oxygen in the blood, ना ऑप्शन सी lack bluish discoloration of mucosa, ना ऑप्शन डी none of the above. तो यार करेक्ट आंसर हो आपनकर कोन ना hypoxia is lack of oxygen in the tissue. तो ऑप्शन ए इज द करेक्ट आंसर. नेक्स्ट এটা hypoxia, এটা আছে hypoxemia. Hypoxemia is option A कौन सी lack of oxygen in the tissue, lack of oxygen in the blood, bluish discoloration of mucosa, none of the above. तो hypoxemia is lack of oxygen in the blood. तो option B is the correct answer. Lack of oxygen in the tissue is hypoxia, lack of oxygen in the blood is hypoxemia. Next question. While measuring blood pressure in upper arm, cursive sound is articulated in dash blood vessel. While measuring blood pressure in upper arm, cursive sound is articulated in dash blood vessel. Option A axillary artery, option B brachial artery, option C femora, option D ulnar artery. तो यार करेक्ट आंसर है आपनकर कोन ना axillary artery. Option A is the correct answer. Next question. Sorry, यार correct answer is brachial artery. While measuring blood pressure in upper arm, cursive sound is articulated in brachial artery blood vessel. तो option B है जो correct answer. Option A no. Next question. While measuring blood pressure from leg, cursive sound is articulated in option A femoral artery, now option A popliteal artery, option C ulnar artery, now option D axillary artery. The correct answer is आपन popliteal artery. Option B is the correct answer. देखिए next question हम आसला हरी. A clinical thermometer indicates temperature in degree Fahrenheit form. Option A 94 to 108, now option B 94 to 110, option C 96 to 108, option D 96 to 110. तो ये करेक्ट आंसर जो कौन 94 to 108. Clinical thermometer indicates temperature in degree Fahrenheit from 94 to 108. Next question. In a child with fever, oxygen demand increases because. In a child with fever, oxygen demand increases because option A metabolic need increases, option B blood sugar level increases, option C patient is less active, option D patient is more alert. तो correct answer is आपन कोन option A metabolic need increases. In a child with fever, oxygen demand increases because metabolic need increases. Next question. Temperature regulation is under the control of option A lungs, option B pituitary gland, option C hypothalamus, option D pineal gland. तो correct answer is option C hypothalamus. Temperature regulation is under the control of hypothalamus. Next question. Assessment of rectal temperature is recommended if a patient has patient has option A arm in cast, option B nasal packing, option C external hemorrhoids, option C gastrostomy feeding tubes. तो यार करेक्ट आंसर हो आपंकर कौन ना तो करेक्ट आंसर हो आर्म इन कास्ट. तो assessment of rectal temperature is recommended if patient has option A arm in cast. Next question. The fall of temperature step by step in a zigzag manner is termed option A lysis, option B crisis, option C homeostasis, ना option D thermostasis. तो यार करेक्ट आंसर दीजिए आपन कौन ना lysis. The fall of temperature step by step in a zigzag manner termed lysis. Next. Relapsing fever is characterized by option A recurring episodes of fever, option B the fall of temperature in zigzag manner to normal, option C in the morning temperature is higher than the evening, now option D temperature comes to normal at least once in a day. तो करेक्ट आंसर is आपन कोन ऑप्शन सी इन द मॉर्निंग. Relapsing fever is characterized by in the morning temperature is higher than the evening. Next question. Which of the following is the characterized by inverse fever? Which of the following is characterized of inverse fever? Option A the sudden fall of temperature from high to normal, the fall of temperature in zigzag manner to normal, in the morning the temperature is higher than in the evening, the temperature comes to normal at least once in a day. तो यार करेक्ट आंसर टी हो आपनकर कौन ना तो यार करेक्ट आंसर हो आपनकर कौन ना इन द मॉर्निंग टेम्परेचर इज हायर देन इन द इवनिंग इज कैरेक्टराइज ऑफ इनवर्स fever. Option C is the correct answer. What? R correct answer is relapsing fever is characterized by recurring episode of fever. तो option R option C no option A is your correct answer. Next question. The sudden return to a normal temperature from very high fever is called option A lysis, option B crisis, option C thermostasis, now option D homeostasis. The correct answer is option B crisis. The sudden return to a normal temperature from very high fever is called crisis. Next, temperature difference between auxiliary and rectal route is option A 1 degree Fahrenheit, option B 2 degree Fahrenheit, option C 3 degree Fahrenheit, and option D 4 degree Fahrenheit. The correct answer is option B 2 degree Fahrenheit. Temperature difference between auxiliary and rectal route is 2 degree Fahrenheit. So next question आमर कौन रही nurse obtains vital sign and determines level of comfort for the patient. Which stand for the practice is performed? Option A assessment, now option B diagnosis, option C planning, now implementation. Now nurse obtains vital sign and determines level of comfort for the patient. तो यहाँ करेक्ट आंसर हो कौन ना करेक्ट आंसर हो कौन ना आसेसमेंट कारण देखो obtaining vital sign is objective data and determining level of comfort by asking the patient is subjective data. Obtaining subjective or objective data from the patient is known as assessment in nursing process. एथिरे include कौन कौन हो diagnosis, planning, implementation and evaluation. Next, information verbalized or stated by the patient is known as information verbalized or stated by the patient is known as option A objective data, option B subjective data, option C science, now option D all of the above. The correct answer is subjective data. Option B is the correct answer. Subjective data are collected or obtained via personal interaction with patient. Next, types of assessment in which more data is collected about already identified problem is option A initial assessment, option B focus assessment, option C emergency assessment, now option D time lapsed assessment. तो correct answer is कौन focus assessment. Focus assessment रे कौन ना data is collected about already identified problem जहाँकि explanation देखूँ तार focus assessment କ'ଣ ନା in initial assessment the assessment is done when the person enters the healthcare facility. Emergency assessment refer to the assessment which is done in the life threatening situation or emergency. ନା କ'ଣ ଫୋକସ୍ ଆସେସମେଣ୍ଟଟା ହେଉଛି ଗୋଟେ ମାନେ ପ୍ରାରମ୍ଭିକ ଆସେସମେଣ୍ଟ ଯାହାକି ଆପଣ ଯେତେବେଳେ ଗୋଟେ ପର୍ସନଟେ କ'ଣ ହେଲ୍ଥ କେୟାର ଫାସିଲିଟିକୁ ଏଣ୍ଟର୍ସ କରେ ସେତେବେଳେ ତା'ର ଫୋକସ୍ ଆସେସମେଣ୍ଟଟି ନିଆଯାଇଥାଏ। କିନ୍ତୁ କ'ଣ ଗୋଟେ ଇମର୍ଜେନ୍ସି ଆସେସମେଣ୍ଟଟା ହେଉଛି এই ଆସେସମେଣ୍ଟଟି କେତେବେଳେ କରାଯାଇଥାଏ ନା ଗୋଟେ ଲାଇଫ୍ ଥ୍ରେଟନିଂ ସିଚୁଏସନ୍ ଇମର୍ଜେନ୍ସି ଆଉ ଟାଇମ୍ ଲ୍ୟାପ୍ସଡ ଆସେସମେଣ୍ଟ ହେଉଛି ଆରେ କ୍ୟାରିଡ୍ ଆଉଟ୍ ଆଫ୍ଟର ଇନିସିଆଲ୍ ଆସେସମେଣ୍ଟ ଯାହାକି ପ୍ରାରମ୍ଭିକ ଇନିସିଆଲ୍ ଆସେସମେଣ୍ଟ ପରେ ଟାଇମ୍ ଲ୍ୟାପ୍ସଡ ଆସେସମେଣ୍ଟ କରାଯାଏ। ତ ନେକ୍ସଟ କ୍ୱେଶ୍ଚିନ୍ ଦି ଫାର୍ଷ୍ଟ ପାର୍ଟ ଅଫ୍ ଦି ନର୍ସିଂ ଡାଇଗ୍ନୋସିସ୍ ଇଜ୍ କ'ଣ ଅପସନ୍ ଏ ପ୍ରୋବ୍ଲେମ୍ ନା ଏଟିଓଲୋଜି ନା ରିସ୍କ ଫ୍ୟାକ୍ଟର ନା ଇଭାଲୁଏସନ୍। ତ କରେକ୍ଟ ଆନ୍ସର ହେଉଛି ପ୍ରୋବ୍ଲେମ୍। ଇମ୍ପୋର୍ଟାଣ୍ଟ କ୍ୱେଶ୍ଚିନ୍ ମନେ ରଖିଥିବେ ଦି ଫାର୍ଷ୍ଟ ପାର୍ଟ ଅଫ୍ ଦି ନର୍ସିଂ ଡାଇଗ୍ନୋସିସ୍ ଇଜ୍ ପ୍ରୋବ୍ଲେମ୍। ନେକ୍ସଟ which type of nursing diagnosis represent condition not currently present in the client but may be developed in the future due to vulnerability or the presence of risk factor? Option A problem focused diagnosis, option B risk diagnosis, option C health promotion diagnosis, option D syndrome diagnosis। तो यह करेक्ट आंसर टी आपनकर कोन ना ऑप्शन बी रिस्क डायग्नोसिस। कारण कौन ना रिस्क डायग्नोसिस रिप्रेजेंट पोटेंशियल कंडीशन और सिचुएशन दैट मे डेवलप इन द फ्यूचर ड्यू टू क्लाइंट vulnerability or presence of risk factor। next question which type of nursing diagnosis is related to the desire or motivation of the client to improve their health status? प्रोब्लेम फोकस डायग्नोसिस ना रिस्क डायग्नोसिस ना हेल्थ प्रमोशन डायग्नोसिस ना सिंड्रोम डायग्नोसिस। तो यह करेक्ट आंसर टी आपनकर कोन ना हेल्थ प्रमोशन डायग्नोसिस। कारण हेल्थ प्रमोशन डायग्नोसिस इज रिलेटेड टू द क्लाइंट मोटिवेशन एंड डिजायर टू improve their health story by adopting health behaviors। next question which type of nursing diagnosis is a clinical evaluation of a set of related problems or risk anticipated to arise from a specific situation or event? କ'ଣ ନା କେଉଁ ଟାଇପ୍ ଅଫ୍ ନର୍ସିଂ ଡାଇଗ୍ନୋସିସ୍ ଇଜ୍ ଏ କ୍ଲିନିକାଲ୍ ଇଭାଲୁଏସନ୍ ଅଫ୍ ଏ ସେଟ୍ ଅଫ୍ ରିଲେଟେଡ୍ ପ୍ରୋବ୍ଲେମ୍ ଆଉ ରିସ୍କ ଆଣ୍ଟିସିପେଟେଡ୍ ଟୁ ଆରାଇଜେସ୍ ଫ୍ରମ୍ ସ୍ପେସିଫିକ୍ ସିଚୁଏସନ୍ ଇଭେଣ୍ଟ। ଅପସନ୍ ଏ ଦେଇଛି ଅପସନ୍ ଏ ହେଉଛି ପ୍ରୋବ୍ଲେମ୍ ଫୋକସ୍ ଡାଇଗ୍ନୋସିସ୍, ଅପସନ୍ ବି ରିସ୍କ ଡାଇଗ୍ନୋସିସ୍, ଅପସନ୍ ସି ହେଲ୍ଥ ପ୍ରମୋସନ୍ ଡାଇଗ୍ନୋସିସ୍ ନା ସିଣ୍ଡ୍ରୋମ୍ ଡାଇଗ୍ନୋସିସ୍। ତ କରେକ୍ଟ ଆନ୍ସର ହେଇଛ ସିଣ୍ଡ୍ରୋମ୍ ଡାଇଗ୍ନୋସିସ୍। କାରଣ ସିଣ୍ଡ୍ରୋମ୍ ଡାଇଗ୍ନୋସିସ୍ ଇଜ୍ ଏ କ୍ଲିନିକାଲ୍ ଇଭାଲୁଏସନ୍ ଅଫ୍ ସେଟ୍ ଅଫ୍ ରିଲେଟେଡ୍ ପ୍ରୋବ୍ଲେମ୍ସ ଆଉ ରିସ୍କ ଆର୍ ଏକ୍ସପେକ୍ଟେଡ୍ ଟୁ ଆରାଇଜେସ୍ ଫ୍ରମ୍ ଏ ସ୍ପେସିଫିକ୍ ସିଚୁଏସନ୍ ଅର୍ ଇଭେଣ୍ଟ। next how many components are there in the problem focused nursing diagnosis? ଗୋଟେ problem focused nursing diagnosis ରେ କେତୋଟି component ଥାଏ? option 1 or 2 or 3 or 4। ତାହେଲେ correct answer ହେଇଯିବ କ'ଣ ନା problem focused nursing diagnosis has a three components। ତ option C is the correct answer। next planning phase of nursing process will determine option A expected outcome, option B intervention needs to be provided, option C change in client condition, option D actual problem of client। तो करेक्ट आंसर ହେଇଯିବ କ'ଣ ନା ପ୍ଲାନିଂ phase of nursing process will determine the expected outcome। option A is the correct answer। କାରଣ each problem is assigned clear measurable goal for the expected beneficial outcome। next question when should planning in the nursing process beginning? After evaluation of the patient health status, na at the time of the patient discharge, na when the patient of the first contact with healthcare facility, na during ongoing care of the patient in the healthcare facility। तो correct answer ହେଇଯିବ କ'ଣ ନା planning in the nursing process should begin when the patient has the first contact with the healthcare facility। ନା କ'ଣ first contact with the healthcare facility। तो option C is correct answer। to develop a plan of care that address patient individual needs and preference। ତ ଗୋଟେ ପେସେଣ୍ଟ କ'ଣ ହ୍ୱେନ୍ ସୁଡ୍ ପ୍ଲାନିଂ ଇନ୍ ଦି ନର୍ସିଂ ପ୍ରୋସେସ୍ ବିଗିନିଂ ଗୋଟେ ନର୍ସିଂ ପ୍ରୋସେସ୍ର ପ୍ଲାନିଂଟି କେଉଁଠୁ ଆରମ୍ଭ ହେବା ଉଚିତ ନା କେତେବେଳେ ନା ହ୍ୱେନ୍ ଦି ପେସେଣ୍ଟ ହାଜ୍ ଦି ଫାଷ୍ଟ କଣ୍ଟାକ୍ଟ ୱିଥ୍ ଦି ହେଲ୍ଥ କେୟାର ଫ୍ୟାସିଲିଟି। ନେକ୍ସଟ ଦି ନର୍ସିଂ ପ୍ରୋସେସ୍ ପ୍ରୋଭାଇଡେଡ଼ ଏ କ'ଣ ହେଇଯିବ ଦି ନର୍ସିଂ ପ୍ରୋସେସ୍ ପ୍ରୋଭାଇଡେଡ଼ ଏ ସିଷ୍ଟମେଟିକ୍ ପ୍ରୋସେସ୍ ଫର୍ ଡେଲିଭରି ଅଫ୍ ନର୍ସିଂ କେୟାର। ତ ଅପସନ୍ ସି ହେଇଯିବ କରେକ୍ଟ ଆନ୍ସର ନା the nursing process provides a systematic process of delivery care। which of the following is a objective data? option A chest pain, option B complaint of dizziness, option C an evaluation of blood pressure, na option D complaints of nausea. तो correct answer is an evaluation of blood pressure. Which of the following is objective data? Na evaluation of blood pressure is objective data. Next question. The patient will remain free from pain throughout hospitalization. This statement is an example of. Now, a patient will remain free from pain throughout hospitalization. This is a statement or example of option A short-term goal, option B long-term goal, option C nursing diagnosis, and option D expected. तो यह करेक्ट आंसर हो आपंकर कौन ना शॉर्ट टर्म गोल ऑप्शन ए इज द करेक्ट आंसर. नेक्स्ट क्वेश्चन आम देखो व्हिच ऑफ द फॉलोइंग ethical principle refers to doing good to the client. Option A beneficence, option B non-maleficence, option C autonomy, option D justice. तो करेक्ट आंसर हो आपन beneficence ना beneficence जो ethical principle refers to doing good to the client. तो देखो किसी अपन पॉइंट्स अच्छी जैकि बेनिफिशियरी डूइंग गुड फॉर द क्लाइंट हूँ आप बेनिफिशियंस और नॉन मेलिफिशियंस हूँ डूइंग नो हार्म. ऑप्शन ऑटोनॉमी हूँ सेल्फ डिटरमिनेशन ऑफ क्लाइंट. तो ऑप्शन ट्रीट इक्वाली हूँ जस्टिस. तो ये भाव आप जहाँ भी क्वेश्चन पड़े आपने लिखिपारे. नेक्स्ट नर्स फेल्स टू administer correct medication to the patient. This action is known as option A negligence, option C crime, option C tort, and option D battery. The correct answer is negligence. Nurse fails to administer the correct medication to the patient. Which is negligence. Next, an international touching of the patient body without consent is termed option C A negligence, option B assault, option C battery, and option D malpractice. An international touching of the patient body without consent is termed as battery. Next, immunization causes pain in child, but it will also provide protection against certain disease. Which of the following ethical principle is applicable here? Justice, na beneficence, na non-maleficence, option D autonomy. Correct answer is option B beneficence. Next, which of the following ethical principle in nursing is defined as treating all patients fairly and equally without discrimination? Option autonomy, option B non-maleficence, option C beneficiary, option D justice. তাহলে এটা কোন হইছো তো নিশ্চিত জানি সারিথিবা আপনার কোশ্চেনটি অপশন ডি হচ্ছে জস্টিস. নেক্সট কোশ্চেন. Physician ordered blood transfusion for a client, but her father refused blood transfusion. Which among the following is the appropriate action by the healthcare workers? Option A try to make the father willing for blood transfusion, option B get court order for blood transfusion, option C do blood transfusion without listening to father, abide by the father's wishes and inform the healthcare provider. तो ଏଠି ଆପଣଙ୍କର କ'ଣ ନା ଏଠି ଗୋଟେ ଆପଣ ଭାବିଚିନ୍ତି ଉତ୍ତରଟି ଦେବାର ଅଛି ନା କ'ଣ ଫିଜିସିଆନ୍ ଅର୍ଡ଼ର ବ୍ଲଡ଼ ଟ୍ରାନ୍ସଫ୍ୟୁଜନ୍ ଗୋଟେ କ'ଣ ନା ଫିଜିସିଆନ୍ ଆପଣ ଗୋଟେ ଅର୍ଡ଼ର କରିବେ ବ୍ଲଡ଼ ଟ୍ରାନ୍ସଫ୍ୟୁଜନ୍ କରିବା ପାଇଁ ଗୋଟେ କ୍ଲାଇଣ୍ଟ ପାଖରୁ କିନ୍ତୁ କ'ଣ ହର ଫାଦର ରିଫ୍ୟୁଜ୍ ଟୁ ବ୍ଲଡ଼ ଟ୍ରାନ୍ସଫ୍ୟୁଜନ୍ ଗୋଟେ ତା ଫାଦର କ'ଣ କଲେ ମନା କରିଦେଲେ ବ୍ଲଡ଼ ଟ୍ରାନ୍ସଫ୍ୟୁଜନ୍ କରିବାକୁ. ତ ଏଥିମଧ୍ୟରୁ ଯେଉଁ ଅପସନ୍ ଦେଇଛି ଆପଣଙ୍କୁ କ'ଣ କରିବା ଉଚିତ ତ ଏଥି ନିଶ୍ଚୟ ଭାବରେ ଉତ୍ତରଟି ଆମେ ଦେଖିବା ନା ଆବାଇଡ୍ ବାଇ ଦି ଫାଦର୍ସ ୱିଶେସ୍ ଆଣ୍ଡ ଇନଫର୍ମ ଦି ହେଲ୍ଥ କେୟାର ପ୍ରୋଭାଇଡ଼ର ଯେ କି ଆପଣଙ୍କୁ କ'ଣ କରିବାକୁ ପଡ଼ିବ ନା ଆବାଇଡ୍ ବାଇ ଦି ଫାଦର୍ସ ଆପଣଙ୍କୁ ହେଲ୍ଥ କେୟାର ପ୍ରୋଭାଇଡ଼ରଙ୍କୁ এই কথাটি ইনফর্ম କରିବାକୁ ପଡ଼ିବ. ଦେଖନ୍ତୁ a nurse administers a wrong dose of medication to a client. Upon realizing the mistake, she immediately reported to the authority and did incidental reporting. This known option accountability, option B responsibility, option C authority, na decision making. The correct answer is କ'ଣ ନା accountability. Next question. Which of the following nursing action is an example of malpractice? Option A administering medication without proper training or certification, option B failing to document a patient vital sign accurately, option C failing to follow a physician order without proper justification, option D failing to follow infection control practice. The correct answer is କ'ଣ ନା ଗୋଟେ malpractice example ହେଉଛି administering medication without proper training or certification. Option A is the correct answer. Next, the patient right to refuse treatment is an example of option A common law, option B religion clause, option C statutory law, option D nursing council act. The patient right to refuse treatment is an example of common law. तो पेसेंट अधिकार अच्छी ट्रिटमेंट रिफ्यूज कराया से आपंकर करेक्ट आंसर कॉमन लॉ. Next, Code of Ethics of Register Notes defined as Code of Ethics of Register Notes defines the option A uniform of care to all clients, option B principle by which notes provided care to their clients, option C protocols to be followed during nursing procedures, option D soaps for patient safety. The correct answer is कौन ना principle by which nurse provided care to their clients. The option B is the correct answer. Now, Code of Ethics of Registered Nurse defines the principles by which nurses provide care to their clients. Next, which of the following is the nurse's best legal safeguard? Option A collective bargaining, option B competent practice, option C written or implied contract, and option D patient education. The correct answer is competent practice. Competent practice of the following is a nurse best legal safeguard. Next, the intention of nurse to do no harm to the patient while providing care is the ethical principle of option A beneficence, option B justice, option C non-maleficence, option D fairness. The correct answer to is कौन ना non-maleficence. The intention of a nurse to do no harm to the patient while providing care is the ethical principle of non-maleficence. Next, which ethical principle promotes self-determination by an client? Option A autonomy, option non-maleficence, option justice na fidelity. The correct answer is आपका autonomy. तो ये था आपनकर किसी इंपोर्टेंट क्वेश्चन. तो जदि आप भिडियो भल लगी भिडियो को लाइक करूँ और तुम सांग सेयार करूँ और हम बारंबार कही रखी आप प्रीवियस ईयर नर्सिंग एप्टीट्यूड जिते भी क्वेश्चन था मुझे डिस्क्रिप्शन प्ले लिस्ट लिंक दी दूसरी आप सब भिडियो देखने जैसे बहुत इंपोर्टेंट हेल्पफुल रहा.